In 1846, inside a hospital in Vienna, women were dying, not from war, not from famine, from childbirth, in one ward. 1 in every 6 mothers who gave birth never left the hospital alive. Doctors called it childbed fever, and they had no idea what caused it. Mothers arrived healthy, gave birth, and within days were gripped by fever, delirium, and death. Priests were a common sight in the ward, administering last rites almost daily. But one young physician was about to discover something so simple, so obvious, that it would drive him to madness before the world ever believed him. His name was Ignaz Semmelweis, a Hungarian doctor working at Vienna General Hospital. He noticed something strange. The hospital had 2 maternity wards, side by side, admitting patients on alternating days. One was staffed by doctors and medical students, the other by midwives. And the ward run by doctors, the one with more training, more prestige, more medical authority, had a death rate nearly 3 times higher. Word of this spread among the patients themselves. Mothers begged to be admitted to the midwives' ward instead. Some women, terrified of Ward 1, chose to give birth in the street on the way to the hospital rather than risk its care, since a birth outside still counted them for admission to the safer ward. Why would the ward with more medical expertise be the more dangerous one? Semmelweis became obsessed with the question. He ruled out overcrowding. The midwives' ward was, if anything, more crowded. He ruled out diet, climate, even the position women gave birth in. Testing every variable he could think of, nothing explained the gap. He even considered whether the presence of priests walking to the doctor's ward ringing a bell before administering last rites might be terrifying patients into decline, and had the priest take a silent route instead. The deaths continued. Then, in 1847, tragedy handed him the answer. A close colleague, a doctor, cut his finger during an autopsy and died soon after, with symptoms eerily identical to childbed fever. Semmelweis, devastated by the loss, pored over the case and realized something chilling. The doctors themselves were the cause. They were performing autopsies in the morgue each morning, then walking straight to the maternity ward to examine patients, without washing their hands in between. They were carrying invisible matter from the dissection table to the delivery bed, from the dead to the living. He proposed a solution almost embarrassing in its simplicity. Doctors must wash their hands with chlorinated lime solution before touching any patient. The results were immediate and staggering. Mortality in the doctor's ward plummeted from nearly 18% to under 2%, matching the midwives' ward almost exactly. He had found the answer. He had saved lives with nothing more than soap and a basin. Surely now, the medical world would listen. They did not. Semmelweis had no explanation the establishment would accept. Germ theory did not exist yet, and the idea that a gentleman doctor's hands could carry invisible poison from the dead to the living was seen as insulting, even absurd. To accept this theory meant accepting that doctors have been killing their own patients for years. Unknowingly, senior physicians refused to accept that their own hands were the problem. Some saw his findings as a personal attack on their competence and reputation, and pushed back not with data, but with pride. He was mocked in medical circles. His theories were dismissed without proper testing. His data waved away as coincidence, and when his hospital contract wasn't renewed, he was pushed out of Vienna entirely, cut off from the very ward where his discovery had worked. He moved to Pest, continued his work, and kept trying to convince the medical world through letters, lectures, and eventually an increasingly desperate and accusatory book, in which he all but called his critics accomplices to murder. He wrote open letters to prominent obstetricians across Europe, naming them directly, accusing them of irresponsible homicide for refusing to adopt his methods. The more he was ignored, the more erratic and inflammatory his outbursts became. Colleagues who once respected him began to whisper that the great obsession had unbalanced his mind. His behavior at home grew increasingly erratic too. Sudden rages, sleeplessness, a mind that would not let the fight go, even as his career and reputation crumbled around him. In 1865, at just 47 years old, Semmelweis suffered what appeared to be a breakdown under pretense of visiting a new institution. He was lured to an asylum and committed against his will. When he realized what was happening and tried to leave, he was severely beaten by guards. Within 2 weeks, he was dead from an infected wound, ironically the very kind of infection his own discovery could have prevented. in the very kind of institution his own vigilance might have made safer. He never lived to see his vindication. Just a few years after his death, Louis Pasteur's germ theory and Joseph Lister's antiseptic surgery proved, scientifically, exactly what Semmelweis had argued all along, that invisible organisms, not miasma or imagination, were spreading disease from patient to patient, from the dead to the living. Hand hygiene became the foundation of modern medicine. Today, every surgeon who scrubs them before an operation, every nurse who sanitizes her hands between patients, is following a practice first proven and paid for by a man the world called insane. Historians now have a name for what happened to him. The Semmelweis reflex, the tendency to reject new evidence simply because it contradicts existing belief, regardless of the proof behind it. His story is a warning that being right is never enough. You also have to be believed, and sometimes the cost of forcing the world to see an uncomfortable truth is everything you have. Your career, your reputation, your sanity, and in the end, your life.